Assalamualaikum viewers and welcome back to my channel Biodinverse Hub. Today in the playlist of oral and maxillofacial surgery, we will be discussing the classification system for the maxillary third molar as we have discussed it for the mandibular third molar. So in this video, we will be discussing about the maxillary third molar and also some factors that will be responsible for the difficulty level associated with the removal of the maxillary impacted third molar. So let us proceed on with that. So first of all, we will be classifying the maxillary impacted third molar according to the angulation, and it will be very much same and similar to that of the mandibular third molar. First of all, on the basis of angulation, it is classified as vertical one, and that has the high incidence. Approximately 63% of the impacted cases in the maxilla of the maxillary third molar that are in the vertical angulation. After that, we can have the distoangular that has the incidence of 25%. After that, we have the mesioangular having the incidence of 12%. And after that, we will have the incidence of 1% that can include the angulation that is inverted, transverse, or horizontal. So we have studied these three as well for the mandibular third molar. Now we will be studying some points or some factors related to the increase or decrease difficulty level associated with the removal of impacted third molar. So let us study first of all the angulation. If the tooth it is mesioangular and overlying there is dense bone, and you also have a very difficult access, so these important factors and the 3 points will lead towards the difficult removal of the impacted maxillary third molar. Remember that mesioangular was easier to remove in the mandibular impaction, but in the maxillary impaction, the mesioangular one along with the overlying dense bone and difficult access is very difficult to remove. Decreased difficulty level associated with the removal of maxillary third molar. If the third molar it is distoangular in angulation or vertical in angulation, so it is relatively easier to remove. That is totally reverse of that in the mandible. Now if the tooth it is palatally placed, the greater amount of bone will have to be removed in order to access that tooth, and in that case you have high chances of damage to the greater palatine nerve and vessel. So in that regard, most obvious it is that it will be very difficult to remove that impacted tooth because it is palatally placed, and as it is palatally placed, we need to remove a lot of bone in order to gain the access, and there are associated structure that was the greater palatine nerve and vessels. There are high chances that you will end up injuring those structure. But if the impacted maxillary third molar it is buccally placed and the overlying bone it is also very thin, then it is very obvious that it will be easier to remove. As the root morphology is concerned, if there are thin non-fused roots with erectic curvature, so it will be very difficult to remove. But if there is fused conical roots, as we know that fused conical roots, they are very easier to remove. If the less pedial space is available, that becomes very less with the age, so it is very obvious that it will be difficult to remove. But if there is wider pedial space as in the younger patient, so again it will be very easier to remove the impacted tooth because you can easily engage your elevators in that space and you can break out the pedial fibers and the tooth can be easily luxated. So after that, the follicular space we have also studied in the mandibular third molar that if it is less, then again difficult to remove the tooth. If it is more, then it is easier to remove, because if the follicular space it is basically governing your difficulty, and if it is whether difficult or easier will depend upon the follicular space. Now if the presence of second molar, there are second molars, they are present, and we have two cases. In first case, the second molars they are present, so definitely you will have a problem with regarding to the access, and it will also hinder your access. So in that case, it will be relatively difficult to remove that impacted third molar in comparison with the one in which the second molar that are absent. After that, if there is bony impaction, that will be difficult to remove, and if there is a soft tissue impaction, then it will be relatively easier to remove that impacted tooth. Now we have as well another consideration in the maxilla, and that is very much important. We have the pneumatization of the sinus. Now, what does the pneumatization mean? Pneumatization mean that the volume of the sinus has been increased. For example, at the start we have a particular size of the sinus, but as in case of any pathology or in case of any other factor contributing towards the pneumatization of the sinus volume will increase, and it will basically, the lining of the sinus, it will come down, and it will be very much in close proximity to the roots of your maxillary third molar. In that case, what is the most important problem to be faced will be if you remove the maxillary third molar. In that case, you will end up in either your roots, if they fractured or they basically breaks during the procedure, it will be lost into the maxillary sinus, or in other words, the infection can also spread to the maxillary sinus. That all was due to, because of the pneumatization of the sinus, that the lining of the sinus becomes it comes down, and it becomes in the close proximity to the roots of the third maxillary molar. So pneumatization of sinus, it is very much important factor to be noted, and also you have to check out on the radiograph as well for the presence of any close proximity of the maxillary sinus and the roots of the maxillary third molar. After that, there is another important factor and important, we can see, anatomical structures. One was the maxillary sinus, and second is the tuberosity. As a tuberosity is present posterior to the maxillary third molar, so there are high chances of the fracture of tuberosity in the following conditions: if the bone is inelastic, if the multi-rooted tooth, or there are very much bulbous roots. In that case also, there are high chances of the fracture of tuberosity. Or if there is large or pneumatized maxillary sinus, in that case as well, you can end up in fracturing of the maxillary tuberosity. Or if there was excessive force used to elevate the or luxate the tooth, in that case also you can end up being fracturing of the maxillary tuberosity. So these were some important points to be considered and to be noted before going on for the removal of the impacted maxillary third molar tooth. So you need to assess all those points, all those aspects that will guide you whether your impacted the removal of your impacted maxillary tooth, it is easier or it is difficult, or there are high chances of fracture of maxillary tuberosity, or there are the chances of infection spreading towards the maxillary sinus or other conditions as well. You have to note it down according to the proposed criteria, and after that you will making the all the treatment plan, and after which you will be going on to start your procedure. So this was all about the classification of the maxillary impacted third molar, and the points that were associated, the factors that were associated towards the removal, that will be easier or that will be difficult. So I hope this video will be helpful for you all. Don't forget to subscribe to my channel and also click on the bell icon so you will get notified about our future videos and updates. Thank you.